Hello there, let's learn about gastritis. What is gastritis? Gastritis is an inflammation of the protective stomach lining. The stomach has four layers, which are serosa, muscularis propria, submucosa, and mucosa. The mucosa is the inner layer and it acts as a protective layer of the stomach. However, when the stomach are exposed with the external factors like smoking, bacteria, and alcohol for a long time, the protective layer will weaken and damage. Gastritis can occur suddenly, or we call it acute gastritis, and gradually turn into chronic gastritis. How does gastritis occur? Let's see the structure of the stomach first to have a better understanding. The circle one shows a gastric gland within the mucosa of the stomach. Normally, gastric gland will secrete mucus that acts as a barrier to protect the stomach wall from hydrochloric acid. However, in gastritis, there is a decrease in mucus secretion and increase in hydrochloric acid production. Thus, hydrochloric acid comes in contact with the mucosal lining of the stomach. Mucosal lining of the stomach becomes inflamed and possible formation of ulcers. Next, what are the causes of gastritis? Firstly is alcohol abuse. Excessive alcohol use can irritate and erode the stomach lining. The second cause is bacterial infection. Helicobacter pylori or H. pylori is a bacteria that live in the mucous lining of the stomach. This bacteria will break down the stomach's protective lining and causes inflammation. Gastritis also can be caused by the bile reflux. It occurs when a bile flows back into the stomach, causing inflammation of the stomach lining. Next is medications. Constant use of non-steroidal anti-inflammatory drugs, NSAIDs, or corticosteroids to manage chronic pain can irritate the stomach lining. Autoimmune disease also can lead to gastritis. In some people, the body's immune system attacks healthy cells in the stomach lining. Lastly is physical injury. A sudden severe illness or injury can cause gastritis. Gastritis can develop even after a trauma such as burn and brain injuries. The signs and symptoms of gastritis are second, heartburn. It is a burning feeling in the chest caused by the stomach acid traveling up towards the throat. Nausea and vomiting. Loss of appetite and bloating. Bloating is described as a feeling full, tight, or swollen in the abdomen. You need to see the doctor if you feel extremely tired. Weight loss. You notice blood in your vomit or stool. What are the complications of gastritis? The first one is stomach bleeding. Erosive gastritis can cause the worn-away areas of the stomach lining to bleed. Next, anemia. Chronic bleeding can lead to anemia, which is defined as a low number of red blood cells. The third one is peptic ulcer. Peptic ulcers are open sores that develop on the inside lining of the stomach. Another complication is stomach polyps. Stomach polyps are abnormal growth in the inner lining of the stomach. Most stomach polyps are harmless. Lastly, stomach cancer. Some stomach polyps can turn into cancer. What are the risk factors of gastritis? The risk factors of gastritis is elderly, family history, and overweight or obesity. How does the doctor diagnose gastritis? Firstly, the barium swallow test. In this test, doctor checks the X-rays of the esophagus, stomach, and small intestine. Patients may swallow a white, metallic liquid containing barium that coats the digestive tract to make the ulcer more visible. Secondly, blood test. Through this test, the doctor can screen for the Helicobacter pylori bacteria infection and anemia. Next, endoscopy test. During the test, doctor looks for inflammation in the throat, esophagus, stomach, and small intestine using an endoscope. A removal of a small tissue sample may be carried out to identify the presence of Helicobacter pylori bacteria. Other than that, stool sample test. This test is to determine whether the patient has stomach bacteria that can cause gastritis. This test also can check bleeding in the stool, which may be a sign of gastritis. Lastly, breath test. During the test, patients will be asked to swallow a capsule of liquid containing urea, then exhale into a balloon-like bag. Helicobacter pylori bacteria change urea into carbon dioxide. If the bacteria are present, the breath test will show an increase in carbon dioxide. What are the treatments for gastritis? Let's have a look together. First, the most medication that can be used is antacid. Antacid can neutralize acid in stomach and also reduce heartburn. Second is proton inhibitor or PPI. PPI able to inhibit production of acid in stomach. The last one is antihistamine. Antihistamine works by decreasing the production of stomach acid. Do you know, other than medication, gastritis also can be treated by acupuncture, garlic extract supplement, and probiotic to prevent or limit the spread of illness. How to prevent gastritis? Firstly, eat smaller but frequent meals. Next, eat on time, so your stomach secretes gastric acid only during mealtime. Manage stress and quit smoking. This is because stress and smoking increase gastric acid production in your stomach. Lastly, avoid spicy food as it irritates your stomach. These are our references. Thank you and bye-bye.